So when individuals come to us and they call up the clinic, they're often asking us what are the unique advantages that Plasticity Brain Centers has to offer as patients. Well, besides our amazing staff, that are compassionate staff, our amazing facilities, our high-tech equipment, we have a couple other core principal things that we offer to individuals that are unique than anybody else in the world. First is our 3x5 model. So we look at this 3x5 model. The way we treat patients are 3 times a day for usually about 5 days. Another unique advantage that we have here at Plasticity Brain Centers is that we don't necessarily fit into the allopathic medical model, but we're also not in the holistic model. We're really the bridge between the two models. What does this mean to you? We're not going to look at you as a symptom or a diagnosis. That's the holistic sort of a part of what we do. We look at you as an entire person. We examine your heart, your lungs, the way your eyes move, your balance, the way you think. We're really looking at the entire body as one whole unit. But then on the flip side, we have the technology and the training to look at you as bits and pieces too. We can look to see if little individual parts of your brain are working properly, if your heart is functioning properly, but then we can switch back and forth between those two models, always asking one question. That question is why? Why is your balance not good? Why do you have headaches? Not just the fact that you have a headache is important to us, but the reason why you have that headache is most important to us. We try to dive down to the underlying cause of any conditions or hurdles that you're trying to overcome and express why you have those problems and then tackle that why with some novel types of therapies. When you talk about another unique advantage, it's the therapies that we do. A lot of times you go to different doctors or different therapists for an individual type of therapy. For example, you go to a physical therapist for physical therapy. You might go to a vision therapist for vision therapy. You might go to a vestibular therapist for vestibular therapy, just like you go to the optometrist for your eyes. So that's part of that individualized allopathic model where you look at people as parts. But all of our doctors here at Plasticity Brain Centers have done training in all of those different types of therapies. We are trained in vestibular rehab, vision therapy, balance disorders, movement disorders, and we have unique therapies that we use to address those concerns. So what this allows us to do is, if you take an analogy of baking a cake, it's not just having multiple ingredients, it's the amount of each ingredient and the sequence in which you combine those ingredients that gives you the best possible outcome.